Hello, Namaskar, welcome you to the SAAR analysis. I am Chaman Nayak and here's my take. We often assume that a healthcare begins when a patient enters a hospital. But what if in rural Odisha the healthcare often begins with a far more urgent question? How many lives are put at risk simply because the doctor is too far away? Think about it, because across 28 districts or 28 villages in Angul and Dhenkanal, a mobile public healthcare unit has already supported more than 35,000 people. This is not just a number, it's a warning, because when one mobile healthcare system is needed for tens of thousands of people, it reveals how far or how large the distance between rural India and essential medical care can really be. And the most dangerous illnesses do not always announce themselves, because hypertension, diabetes, and health disease, these conditions can remain invisible for years until they become a stroke, until they become a medical emergency, and until they become a financial catastrophe for a family. Here's what evidence speaks about, and the evidence are now clear and precise that a mobile public healthcare unit is bringing doctors, medicines, diagnostic tests, and preventive screenings into remote communities, and that is changing the meaning of access. Because for an elderly person who is unable to travel, a woman facing a mobility crisis, or a daily wage worker who cannot afford to lose an entire day reaching a hospital, this is not just simply a healthcare services, it is a difference between early diagnosis and a delayed disaster. Because the mobile public healthcare units model has brought medical attention directly to the people who may otherwise remain outside of this formal healthcare system. And that matters, because rural healthcare crises are rarely caused by the absence of hospitals. They're often caused by distance, they're often caused by transportation costs, they're often caused by missed income, they're often caused by delayed testing, and most importantly, they're caused by belief that symptom is not serious enough to justify an expensive journey. Now the question arises, why is this important? Because this is not an Odisha story, this is the India story, and increasingly it's a global south story. Because across emerging economies, millions of people live within this healthcare paradox. Medical system may exist, but they remain physically, financially, or socially out of reach. The World Health Organization has repeatedly warned that non-communicable diseases, especially cardiovascular illness and diabetes, are becoming one of the major or largest health burdens across low and middle income countries. That means the next public health emergency may not arrive as pandemic, they may arrive quietly through untreated blood pressure, through undiagnosed diabetes, and preventable complications in communities that never received an early care. For India, this mobile health system can become a strategic shield, and they reduce the pressure on the district hospitals, and most importantly, they can bring the prevention closer to homes. Now, here's what the bigger picture is: the Odisha has an opportunity to turn into more than a service initiative, because it can be scalable as a rural healthcare model, one that combines mobile clinics, one that combines digital health, one that combines telemedicine and local healthcare workers and real-time disease tracking. This is where the healthcare stops only about building, it is about breaching. And because a hospital may save a life during an emergency, but a preventive healthcare can stop that emergency from happening in the first place. Now here's my take: the success of a mobile public health unit should force a larger policy question. Why should it get access to a doctor depends on the person's PIN code. And if 28 villages can reach more than 35,000 beneficiaries, then Odisha has a proof that healthcare can travel faster, healthcare can travel further, and more intelligently, healthcare can travel almost every rural economies. The question is not whether this model works or not. The question is, can Odisha scale it before the next silent health crisis become impossible to ignore? Let me know in the comment section. And that's all from today's analysis. I will be back with another episode. Till then, thank you for watching this.